Potting balls may look easy for Conrad Farrell, but his snooker skills come at a price.
Even now I still have to sit down every sort of 5 or 10 minutes if I'm not playing, and when I am playing I will sit down in between shots.
Mr Farrell developed a degenerative spinal condition in 2016 and needed surgery within 3 years. Stuck on the elective waiting list when COVID hit, he didn't come off it until last August. And now, while grateful for the treatment, he says delivery took far too long.
While I was in that point of waiting for the surgery to happen, every day in agony, essentially, every day felt like a week.
A new health tax announced in last night's ACT budget aims to improve service delivery across the public system. But Mr Farrell's not sure it's the right approach.
You add another $250 onto an already expensive bill, it's probably going to hurt a lot of people.
All Territory ratepayers will pay the levy, and as the Finance Minister heard today, most aren't happy about it.
They're saying it's just a lazy tax.
Well, it's one of the few avenues that we have available to us, so I don't know that it's lazy. I think it's
But why just the ratepayers? There are so many
The measure is expected to inject more than $205 million into the Territory coffers over 4 years. The government maintains it was caught between a rock and a hard place, with healthcare the biggest cost to the ACT budget, accounting for roughly a third of all spending, and a directive issued by Canberrans during the federal election.
They were not interested in slashing public services as a way to undertake budget repair. So we have done, I think, a balancing job.
While some Canberrans think it's a reasonable revenue raiser, plenty more disagree. The ACT government is laying some of the blame at the Commonwealth contribution.
Should be 45%, could go as low as 33% unless they contribute more into the system, and so that will be the subject of quite intense negotiations.
I will make the point that next week the Commonwealth will increase its funding to the ACT hospital system by 16%.
No pain, no gain. Emmy Groves, ABC News, Canberra.